This episode will bring you the latest advancement and expert opinions on lung cancer awareness. I'm your host, Dr. Lavanya, and this session is specially focusing on empowering AI and oncology. We welcome you, sir.
Thank you. Hello, all.
Now we'll start with the emerging technology in the field of the medicine, sir. So, why you have chosen the topic of AI in oncology? Why you think it's important for everyone to know about AI in healthcare?
Okay, since long we have seen how the medical career and the field has been progressing from the days of conservative treatment. Now we are utilizing these technologies everywhere, including surgeries, robotic surgeries, and now the precision field has been evolving a lot. Where we are talking about immunotherapies, target therapies, and everywhere the technology is making a large impact. It also saving us a lot of time and also saving a lot of human effort as well as increasing the precision efficiency. So in this regard, we are hearing a lot about artificial intelligence in every aspect, and somebody are fearing about it and somebody are liking it. And in oncology itself, we are seeing leaps and bounds of changes with the impact of artificial intelligence. So the moment artificial intelligence has been tried in medical field, and then the challenging role in cancer, the detection of cancer itself is a challenging thing, because most of the times we see there are a lot of misdiagnosis in the early stages, and the moment that diagnosis comes out, most of them will be in advanced stages, so we are not able to save them. So the moment you are able to find some technology which you can utilize to detect them early, the key thing in curing cancer is early detection. The moment you have early detection, early stage, you can cure it. So we are seeing a lot of impact of artificial intelligence in diagnosing, screening, now treatment, also in how to prognosticate in the future, how they will respond to your treatment, how the follow-up can be done, whose resistance is more for the perfect type of precision treatment or not. This all we can utilize in using AI. So that's why I would like to talk about this today, and we'll discuss on that.
Sure, sir. That's really a great introduction about AI, how it is useful in the field of medicine. But as you already know, different people are having diverse opinions and misconceptions about AI. Like some people are thinking it will bring advances, it will make use of the mankind, it will reduce the manpower and all in healthcare. But what's your takeaway, your opinion on AI in field of medicine?
Okay, there are always two schools of thought in medical practice. One is conservative, the other is progressive, or some are aggressive, we can call them. So the moment people like to follow the gold standards which have been tested and tried from many years, or you can call decades, and people are happy with that. And some people would like to take up the risky cases or the challenges and try to find out the new treatment methodologies where they are not existing. In this arena, where there is a challenge to find new treatments, I always like to see a positive landscape where we can try something new and find a treatment or cure or some kind of management where it is not existing. So I always go for a positive approach, and I like the impact of AI on this.
Oh, that's a valid point to keep on AI, sir, because that might clear so many people doubts about AI in healthcare. Further, moving on to the next question, sir. Could you tell our listeners about the role of AI in personalized treatment plan for individuals? Every person reacts differently depending upon the cancer staging, and everybody reacts differently to a treatment needs for the oncology cancer treatment. So, what's the role of AI in personalized treatment plans for in oncology?
Okay, coming to effect of artificial intelligence in treatment and making it tailor-made treatment plans for each of the oncology patients, that is cancer. For example, you take lung cancer, breast cancer, who may be in suppose advanced stages, like they may need immunotherapy or target therapy. Sometimes some may work for some people, sometimes they won't work for the other people. So it is always the best way to find out which one the drug which the person responds properly, and identify that. And if you utilize it, there may be very good efficiency instead of wasting the golden timeline. And for example, what AI does is it takes up all the patient characteristics through the scans which have been done with the diagnosis, and through that it can always have a information. You have a lot of libraries now built up in AI which can prognosticate, like which type of regions may respond properly, which type of regions may not respond properly inside the same tumor itself. And matching it with the already existing treatment plans, it can also say which drug is best beneficial for the existing patient based on the characteristics. So it takes off genomics, clinomics, and also radiomics. All these data it can take within a less amount of time. Also along with the pathological data which it has, it can give what is the prognosis, which drug benefits the person, and what drugs are not useful. In this way you can save a lot of financial burden as well as reduce the timeline of the treatment.
Thank you so much, sir. That was really an interesting opinion to know on AI, how it reduces the time in the treatment plan of a cancer patient, because like they'll be depressed all the time, staying a longer duration in hospitals. I think AI helps in that perspective. So, doctor, further moving on, we'll take few of our questions from the attendees.
Hello, doctor. So, what are the common misconceptions that contribute to the stigma in association with smoking and lung cancer?
See, there are a lot of misconceptions that keep floating around regarding cancer, and especially regarding lung cancer and smoking and non-smoking. So the moment people do have a risk factor like smoking, it doesn't mean everybody who is smoking is going to get lung cancer, and doesn't mean that who is not smoking is ending up without any lung cancer. So it is one of the possibilities that may increase the risk of the lung cancer. So the problem is stigma is around the cancer itself. When people think there is cancer, they start thinking these people are going to die. They don't have any treatment, and this has been increased drama from the movies, which we see. The moment the person gets cancer diagnosed, they will show him just bedridden, coughing of blood, and dying on the floor within no time. But in my career of 13 years, I have never seen a single person having that type of scenario. And especially lung cancer, I do have patients who have treated. They are still going to their gyms, and unless they say themselves, and nobody knows whether they have lung cancer or not. So instead of having a taboo that there is no treatment for cancer, people should get aware that there is a lot of advancement in the medical field, and you have cure rates. Almost 70 to 80% of the cancers can be cured now. Unless you leave it to the advanced stages, it is very easy to cure them. Even if they are into advanced stages nowadays, early advanced stages, we are still able to control their tumor burden, and they can live longer life compared to the older days. So remove this taboo or stigma of this cancer, and don't believe the drama that goes in the movie. That's primary thing which is more impacting everybody, because even I go to North India, etc., people, the moment you say they have cancer, they just forget everything and they go home. They don't want to get any treatment. So this should change, and that should come from the people who are getting this awareness. You should spread this word. Thank you.
Hi, Dr. Pradeep. So, what role does genetic disposition plays in development of lung cancer, and how an individual with a family history can take prevention?
Okay, genetic predisposition is a very important thing in oncology, as per se in cancer treatments, but the impact is very low. Like only 15 to 20% of patients who are coming with lung cancer or any type of cancer are genetically predisposed. But saying that it is very important, they should have very strict timeline to follow for screening, because compared to normal population, the people who have this genetic predisposition like familial history or hereditary or having some genetic mutation in their parents or grandparents will be having development of these type of cancers from an early age. That's why especially if you take lung cancer or any breast cancer or something, if a person in your relatives or in your parents or grandparents had it below 60 years, definitely there is a chance that the next generation should be checked for at an earlier stage, like 10 years before. Like if a person has got it at 50 years of age, you should start screening from 40 years of age. So early screening saves any development of a nodule or something, a kind of benign tumor or cancer, to be detected early. So you can nip it off in the early stage and it can be cured off. Instead of waiting for the regular timeline, they should go for early screening.
Thank you, doctor.
So we further move on to the next question, sir. Can AI assist in predicting the response and specific treatment cancers for the better outcomes?
Okay, so as we have just spoken about that, if a person is being started on some kind of immunotherapy or target therapy or precision medicine which has been given to person, there are already so many patients have been treated before, and we all have the data available for that. and who have been responding, what type of persons with similar characteristics are responding or not responding. So all this data is available with AI. So you can choose which will prognosticate, which will give benefit, which will not benefit. So the moment, instead of initially what we used to do, we used to hit and trial method. We used to give one medicine, wait for 3 months, check for the assessment using a PET CT scan or something, and then with that again we used to see whether to go for the same medicine or change again. So it takes a lot of time until you reach a proper medicine which is working for them, unless the first medicine itself is working. So when you have a chance of AI utilizing it, this cumbersome work and also the timeline can be reduced, and based on the data of the patient and based on the efficiency of these target therapies where it works. Now most of the people might be having these genetic mutations, example lung cancer, might be having ALK mutation, ROS, BRAF, etc. So many genetic mutations now available to detect them. If you are able to detect them and you can put a personalized precision medicine which works only on that mutation, you are saving a lot of normal cells from getting affected as well as working exactly on the tumor. So this increases the efficiency. Also, you can increase the survival of the patient.
That's really an interesting answer to know, sir. As you said, like it will be like reducing the duration. We'll be knowing about the drug which works on patient in a faster note. That will be really helpful emerging field in medicine. That will further move on to the next one, sir. What advancements have been made in targeted therapies for specific subtypes in lung cancer? What do you think? How they differ from the traditional treatment methods?
Initially, the lung cancer treatment used to be based on stage wise. Early stage used to treat with surgery, and moderately advanced stage 2, stage 3 used to treat with radiation, and further, if it is advanced to stage 4, used to give a chemotherapy. But the moment the person is treated with the stage 4, the chance of survival drastically drops to 20%, which is actually some 80 to 90% in the earlier stages. Now with the technology evolved, we are able to treat even earlier stages with radiosurgery without even putting a knife, and second stage 2, stage 3 with advanced radiation, which doesn't have any side effects. And when you come to stage 4, the key factor comes with the chemotherapy, targeted therapy, or immunotherapy based on what is beneficial for this. So we have different subtypes of lung cancer, which we have already seen, like squamous cell carcinoma, adenocarcinoma, and if person has adenocarcinoma, there is a possibility of a genetic mutation which is leading to that. So they are called ALK, ROS, BRAF. Some examples are there, which we have already existing treatment drugs. So if you are able to do histopathology, IHC, and further genetic mutation analysis, if any of these mutation is found, we have a ready available medicine for that. So instead of undergoing the heavy chemotherapy, which they have a lot of side effects, and some people may bear it, some people may not bear it, and lost to follow up, thereby increasing the progression. So if you are able to put them on a single drug, it's an oral tablet or sometimes an injection. So this increases the compliance of the patient and exactly targets the mutation. So initially with chemotherapy, the patient used to live around 3 months to 9 months or something. But now we are able to increase their survival up to 5 years. That's a tremendous impact. So the precision medicine targeting the molecules increases a lot of efficiency.
That's really great, sir. Further moving on to the next one, sir. What are the challenges in diagnosing lung cancers and how does the population differs in the treatment options? As there was always been a misconception that only smoking people are diagnosed with the lung cancer. What's your takeaway on that?
Yeah, this is actually a very tricky thing. People always think smokers will get lung cancer, non-smokers don't get it. But the rising trend which we are seeing is so many people are having lung cancer, but they don't have any habits. If you go down to their deeper analysis, some people might be having genetic mutations and some people might be exposing to different things. This comes down to what are the risk factors of lung cancer. So as smoking is one of the biggest thing, and other than smoking, passive smoking is one more thing. People who are not smoking, they think they are not smoking, but actually they are having a passive smoking around. That impacts a lot. Along with this, now air pollution and hazardous places where they're working, like occupational hazards, which we call. People working in factories of asbestos, some kind of vinyl molecules or some aromatic compounds, and they all keep on inhaling some minute carcinogens. These all can lead to lung cancer. So people who are not cancer, I mean non-smokers, doesn't mean they are totally free from that. You should always be on pinpoint and check up your screening at the right time. That is very important, and don't neglect even early symptoms of it.
So, what do you suggest, sir? Like, passive smoking is a thing we can't avoid because people are surrounded by smoking. We can't tell them to stop smoking. So, what do you think the preventive measures passive smokers or asbestos and different kind of occupational industries people are working? What are the preventive measures they can take to for early detection or to just prevent from getting a lung cancer?
So the first, as you mentioned, you cannot tell a person not to smoke. That is a mindset that is being developed. So first, you should change the mindset of the people. You should be strong enough to tell them to stop it. Otherwise, if you are insecure, if you are not able to tell them, everybody will be free with doing. And the other thing is educating the people who are smoking to go to a smoke room, so that they'll be helping others from not getting impacted with this. And the second thing is pollution. Stay away from it as much as possible. So the people who are chronic drivers and who are always on the roads, most of the times you can see they are always impacted with air pollution. So increase the greenery, take out your time to spend inside the nice fresh air. That is very much important. And other than that, in occupational persons who have almost every day they are going to work in such hazardous places, make sure you should have all the prevention aspects which can prevent them inhaling the carcinogens, like giving them proper respirators, and also any chances of purifiers which can be placed, which can uh, absorb all the dust that comes out, and it is not freely available in the air. So these small minute things which you can take off will help a lot in the long run. And along with that, if people are always in risk of exposure already, get them screened in right time. That is very important. So not just smokers who are all having all these risk factors, they should start getting screened from at least 30 to 40 years of age, and every 1 to 2 years you can go with low dose CT scan and X-ray. Or people who are having some chronic cough or symptoms, they should get evaluated thoroughly. Just some people always neglect these things. It's just cough is, it might be some infection, it might be some TB. So people always get these treatments for 1 month, 2 months, and then they come to us when it has already advanced. So instead of conserving the financials for diagnostics, people just go for giving some pills and they increase the timeline to diagnosis. This is actually golden time. You are stretching from stage 1 to stage 4. So if you are able to find it initially, you are saving a person. It can get cured. It's not you're going to like the moment cancer, it is not that you are not able to get cured. If you are getting it before it advances into stage 4, you can always cure it.
Sir, there are a few questions from our attendees. We'll go on to answer the queries today.
Hi, doctor. So, what are the screening initiatives are available for early access of lung cancers? So, how can an individual get the access for?
Okay, screening for lung cancer has been existing and perfectly organized in the since long, and everyone who has a high risk, like we have already discussed about the what are the risk factors, and if anybody comes into this category, they can always approach any hospital, because the lung cancer screening is very simple. Either you can start with having a plain X-ray, or if you are affordable, it's always better to go for low dose CT scan of the chest. So this that can be done every 1 or 2 years. Who are having high risk smoking, that is at least 20 pack years of age, that is a minimum criteria that we are having now, or who has hereditary or genetic predisposition. These people can have either annually or biannually low dose CT scan or X-ray, and these are available in every diagnostic center or even any small hospital also. So you should always utilize this in a timeline so that you can get prevent it or find it earlier. Thank you.
Hey doctor,
Hello.
what are the factors that contribute to metastatic nature of cancer?
So lung cancer that progresses to advanced nature, a major thing is if you're not stopping or detecting it early. So the moment any cancer starts in your body, it continuously keeps growing. It starts at a very local stage where it is just surrounding its own tissues. The moment it crosses that level and goes to surrounding lymph nodes, and from that lymph nodes it starts spreading to every place of the body. So whenever you see a lung cancer which is going beyond its regional place, that is called advanced or metastatic stage. It can go to lungs, brain, heart, or even bones, or even any other visual organs, depending upon how much time you are giving it to further it. So it is very important to detect whether it is a metastatic or not. So for this, we need to have a whole body scan. That generally, once the diagnosis of lung cancer is done, we ask for a PET CT of the whole body, which can show us from head to toe if there is any spread of the cancer from its primary region. So based on that, we'll change our treatment plan. Thank you.
So, Dr. Pradeep, what are the early signs and symptoms of the lung cancer that an individual should be aware of for early detection of the cancer?
Actually, a nice question. Everybody should know about this. Lung cancer initially doesn't show any symptoms. The moment it starts showing symptoms, earliest signs and symptoms would be persistent cough, and sometimes it may have hemoptysis, that what we call as like a blood in the coughing sputum, or sometimes they may be having a mild chest pain wherever it is impinging on the nerves or on the bones. Otherwise, most of the times there won't be any symptoms, and sometimes it may develop into shortness of breath, or sometimes if they start walking, they will have some breathlessness, that is called dyspnea on exertion. These sometimes look like infectious or some cardiac related, but most of the times if they are not reducing with medication for 1 week or 2 weeks, definitely they should go for thorough checking. Other than these three things, there won't be much symptoms. So you should remember cough, shortness of breath, hemoptysis, that's blood in the sputum, or sometimes chest pain.
Thank you, Doctor.
Hi, Dr. Pradeep. So, my question is, what are the implications for cancer staging and treatment strategies?
Okay, in treatment of cancer, it is very important to do a staging, and thereby treatment modalities are decided. So for staging, we need to have a imaging for seeing how much is the spread of the cancer, and for also we need to have a pathology that decides what type of cancer it is, what subtype of cancer it is. So once you get this information, you can stage the cancer into stage 1 to stage 4. So early stages like stage 1 or stage 2, we can treat with either surgery or radiation therapy based on what is the type of cancer. For example, in lung cancer, early stage 1 cancer, you can treat with either a small surgery, or you can do a radiosurgery with radiation. And stage 2, stage 3, you can always treat with chemoradiation. And then coming to stage 4, this is called an advanced stage. That means it has been spread from the local region to different parts of the body. The moment it spreads to different parts of the body, the treatment of curing becomes very difficult, and we try to manage it with improving the survival or improving the quality of life. So it is very important to stage it, and based on that we change our treatment strategies. And at stage 4 cancers, we generally give a chemotherapy so that we can control the tumor burden and to increase the survival quality of life.
So we will further go on the discussion for the next questions.
Okay.
What challenges usually arise from implementation of AI in oncology? As already discussed, there is a lot of the data we need to implement the use of AI in oncology, and a lot of the patients will be hesitant to give their data, and it's a difficult process to collect the data. What's your takeaway on that, sir?
See, AI itself is a major technological thing, and implementing it in a conventional healthcare aspect itself is a big challenge, and making people believe and accept it as a part of their regular medical profession itself is a big challenge. And the problem with some of the concerns which surround this thing is the data. AI needs a lot of data, especially from the patient's characteristics, patient's personal information, patient's data sets across years and years. And some people might be worried about this data may not be secure. And some people think that this technology may not always be efficient enough to give us exactly the accurate results. It may be giving sometimes a false report can also happen with the if the technology is not driven properly or not programmed properly. So all these things along with ethical challenges are also there, which need to be addressed before completely imbibing this artificial intelligence into healthcare.
That's completely true, sir. Coming to false positive and false negative results, that are so common with the technology we encounter in our daily lives. Yeah, that is an important thing to consider, sir. Thank you so much. We'll further go on to the next question, sir. Would you like to discuss any challenging case, either might be an AI-based case in the oncology or lung cancer awareness case you want to discuss with us in your 13 years of your experience, sir?
See, there are multiple challenging cases we have seen across, and since we are talking about lung cancer, we'd like to talk about lung cancer. See, I have seen one case, a patient had come up with a kind of cough, and he's not going to the doctor, and he's just taking his own pills just from the pharmacies and all. So finally, because he is able to go through some small clinics, he was asked to take a chest X-ray, some consultation. They get treated as an infection, and the time delay happened so much. By the time they reached us, we have seen it was around almost 9 to 10 centimeters of mass in the lung with lung collapse, and he almost came to the emergency with a shortness of breath, and from there to a pulmonology department. There we are able to sustain him and do the biopsies. Then we came to know it as a lung cancer instead of any other consolidation or infection, along with the lung collapse. So first we tried to resuscitate him with the available facilities in the ICU. Then the moment he was able to come out into normal level of vitals or hemostable conditions, then we further started treating with this patient. And being such a huge mass, and considering his advanced age, the good thing is it's still in the local area. It still didn't spread to other areas. It's in the just in the lung itself. Yeah. So we were able to take him for radiation. That too, we did a hypofraction radiation because he is not fit for chemotherapy at that stage. Because there is a chance that it might be going into lung, other lung. So it will be around borderline of stage 3, stage 4. So we took it from hypofraction. We finished off within 3 weeks of treatment, and he responded very well. The tumor shrunk a lot, and he is able to do his normal life, and he is able to breathe normally. And after that, we started him on target therapies, and we have seen in follow-ups that has reduced a lot, and completely he is doing his daily routines, and he is not having any difficulties because he has such a huge cancer before, and he is continuing on that, and he is very much positive, and the tumor almost shrunk to 20% now. So we are able to save him from that stage where he is having a distress of breathing to this stage where he is completely doing his normal daily life.
That's a really interesting case, sir. As you said, like early diagnosis, early knowing of we are affecting from something is very important. Not only just for doctor, even the patients should be aware that they're facing some difficulties rather than prescribing for their own and going for some other medications. Thank you so much, sir. As we are discussing on cases, can you tell us anything related to AI related case you have treated so far, sir?
See, AI is a very new thing in oncology or medical field itself, but I have been involved in the radiomics, that is use of this CT scans or MRI and the imaging data to prognosticate the effect of the treatment or how long he will survive. These all data can be done with radiomics that I have been doing from long, and we have seen patients who are having similar kind of without this AI we see breast cancer. Okay, 3 patients are there, all are having breast cancer on same stage, we treat them same way, and some one of them may respond, one of them may not respond. So we have utilized this radiomics data to see which kind of drugs work for them, and based on the regular treatment which we are giving, what are the grayscale patterns which we are seeing in the images. Some have the prediction that it may not respond so early, and some look like aggressive. So we have utilized it. So we have went for aggressive treatment for them, and who are more prone for excellent responses, we have done for conservative level of treatment instead of going for very aggressive level. So this way we have utilized this radiomics data, and still we are using this, especially in lung cancer or breast cancer or prostate, which are at the advanced levels, and still we have time to treat them or manage them for prolonged cases.
That's really interesting to know, sir. We'll further move on to the next question. What resources or references would you recommend our listeners to know more about the researches or advancements in oncology?
Oncology per se is ever evolving and rapidly changing. So the resources are abundantly available online, much more than having a regular conventional textbooks. So I suggest you to look up to date. That is an excellent resource for all the medical fraternity, and especially the oncology, because of the new treatment being updated every few days. So it is very important to have the updated treatment modalities being known. And the other thing is NCCN. These people provide guidelines. How do you treat each case in oncology, that is cancers, and they update every 3 monthly. And most of the world, we are following these NCCN guidelines to treat each and every cancer. And they have given nice flowcharts, algorithms which can be followed easily, and also nice summarizes where you can understand the key importance of which treatment modality is good for which stage of which type of cancer. And also you can take a call based on there is a guideline. Always remember, guidelines are guidelines, they are not strict recommendations to follow. You can always take a call based on your personal preference and the patient, and you can make a tailor-made treatment. So, and the other thing is ESMO, that is from the European Society of Medical Oncology. They also releases excellent guidelines for all cases of cancer. Other than this, we have nice annals of oncology, ASCO journals, Nature, and Journal of Oncology and Adaptive Oncology. There are so many new prestigious journals that are publishing these data every year. So it is better you follow these latest journals than just sticking to your old textbooks.
Thank you so much, sir. We have one last question for today's session. What are the 3 take-home messages you want to give to the people regarding either might be AI in oncology or might be a cancer awareness, might be a myths and misconceptions about the cancers? What do you want to give about our listeners?
So the first thing is never fear about cancer, and spread cancer awareness among everyone so that you can make them detect it early and the cure rates become higher. Second thing, imbibe and use the technology whatever is available so that it gives you a positive impact on your diagnosing or treatment or even follow-up and reduces the human burden. Third thing is, other than these things, you should always look out to a holistic approach for every patient. It's not just one person is being treated for cancer, doesn't mean only you look up to cancer. There is a lot of other things happening inside the body along with the treatment of cancer, and the treatment of cancer is a very lengthy process. So there should be always a holistic approach, including the diet, nutrition, and how the patient is able to take up the medication, and how fit he is, how is his immunity. These all should be taken care as an overall health while treating for cancer patients.
Thank you so much, sir, for taking your time out for us in your busy schedule and giving such an informative session on emerging field in the emerging technology in the field of medicine, because as a doctors, they might be not that much aware of technology. But thank you for sharing that information with
Thank you
us.
for inviting me for this nice session. I'm able to spread this word to everyone else from you. Thank you.